Hey, can you see me?
Yeah, can you see me? Someone walked right through me back there.
We might be dead. Are we ghosts?
How could I have done something like this to myself? What was I thinking?
I know, I was thinking I could have done something different too.
I wish I could have talked to somebody.
I think there are places that we could have went.
Can you show me?
Sure.
The ghosts travel further. Will we see more of the ghosts?
Yeah, we were able to use the concept of the ghost to do a bit of a walkabout to key services. And so they've gone on this journey and they actually become the eyes of the viewer.
Welcome everyone to Where We All Belong. Today we have a guest, Chris Goble, who is the coordinator of the Integrated Case Management Team with Island Health, Mental Health and Substance Use Services. So welcome, Chris. Could you tell us a little bit about who this service is for? Who's it targeted to?
Yeah, for sure. So the ICM team works primarily with people who are actively engaged in substance use. Typically, most of the people that we work with are homeless or underhoused. They're adults, so we're 19 and over service. They also probably have what we would call concurrent, so that might be things like, it might be concurrent in the way of health, so things like HIV, Hep C, infection, wounds, those kind of things, primarily from being homeless and from living rough, for sure. And then also they probably have had inadequate access to healthcare services. So they don't have family doctors typically. They may or may not have access to other services, or may have in the past other Island Health services. So yeah, that's typically who we work with. They may be involved with police or forensics as well on an ongoing basis. Yeah, so I think that's who we primarily work with.
Thanks. And what happens when someone engages with your service? What happens with that?
Typically, the team will meet with the person. We go through a bit of an initial sort of assessment, or we meet and sort of meet and greet with the person. We develop an individual partnership plan with the person, and that really is about what services or what they're looking for. So it's kind of a hard question for me to answer from the ICM perspective, in that it's so different with everybody that we work with. Some people it will be housing, some people it may be harm reduction supplies, some people it might be withdrawal management services that they're looking for, or referral onto maybe a house treatment option. It might be just support for where they're living in the community. It might be all of those. So it really varies, but I guess the basis is that it's an individual partnership plan with the person and whatever services they're looking for. Might be advocacy. Yeah, there's lots of different options. It might just be support getting to appointments, because typically when people are actively engaged in substance use and they're homeless, they're having a hard time accessing other services, so they have a hard time making appointments, getting to places on time, and we work from an outreach perspective, so we can help people get to and from places if that's what's really needed at that point, instead of actually duplicating service. So it could be any one of those things really, but the bottom line is that really it's developed in partnership with the person.
Great, sense it's very wide in scope.
Yeah, I mean, that can be a little bit problematic for us too, because it's hard to explain what we actually do. But yeah, it's really tailored to what the person is looking for at the time.
So you said outreach. What are your hours of operation, and you know, how do people connect with you? Can they drop in, or?
Yeah, so anybody can be referred. There's a referral process. Once they're partnered with ICM team, we will have standing appointments with people where we'll go out. We'll do just outreach, so we'll connect with people out in the community. The hours, we've changed our rotation recently, so currently our hours are 8 in the morning till 6:30 at night, 7 days a week, which is new for us. We're a small team, so we don't have drop-in per se, where it's just open, but we do have we run a clinic with one of the GPs every 2 weeks. So those are set appointments, but if a person is having some trouble getting to appointments, we'll go pick them up and bring them to the appointment so they don't have to get there on their own. We do have some things that are booked in the office, but generally the office isn't open because we're an outreach-based team. So we go out and see people where they're at.
Is there a cost for any of that?
No, there's no cost. It's an Island Health program. So it's through mental health and substance use services within Island Health. So it's free to people to access.
Okay, thanks.
So this program is called Where We All Belong, and about the local substance use services. How would you say that the ICM team fits into the continuum of services in the Valley, or does it?
I would think it does. I think ICM was designed to work with people that are engaged in their substance use and homeless. So really what that means at the end of the day for Island Health, from the Island Health perspective, I guess, would be this idea that these people haven't been able to or have been unsuccessful for whatever reason to access more traditional mental health and substance use services. So they have a hard time making an intake appointment, or they have a hard time engaging with a set appointment every couple of weeks, or whatever that looks like. So in that sense, these are people that have probably tried to engage with health services and have not. So in that sense, we're a substance use team that will go out and engage with people where they're at. So I think that's probably the new bit for us at Mental Health and Substance Use. Community agencies have been doing that for a while, but it's new for Island Health for sure, that idea that we'll go out and connect with people where they are. And I guess probably the other difference for us within the substance use service is that we're kind of a harm reduction based team. So in more traditional services, there was an idea that people will engage with substance use services with a goal of changing their behavior around it. Also within that is harm reduction, where with ICM, there's no expectation that you're wanting to change your substance use behavior at this given time. So we can work with people who maybe we're just working with them or partnered with them around the housing piece while they're still engaged with their substance use. So we may be providing harm reduction supplies or some other things around that, but there's no push that it's like, okay, or are we looking at, moving into some other sort of service? It's, if you're engaged in your substance use, how are you making that safe? So I would say, yes, we fit in the substance use continuum, but probably a little different place than the more traditional mental health and substance use services have been.
So how would you describe success in the work that you do? And so how does that look? I know you're a fairly new program, but there's all kinds of different ways to describe success, and not just as you say, the traditional way. So how would you describe success for someone in your program?
Again, one of those interesting questions. I don't know that I would. I think I would probably leave that to the person we're partnered with. Are things better for them from their perspective? Right. Has engaging with the team made a difference in their day-to-day world? For me, that would be a success. If they said, hey, I was here before and I'm still here, but I feel like I'm a little safer or things are a little different for me, then that would be fantastic. I mean, there's also all the other systemic measures. So, they weren't housed and now they have a house. There's all those things that the system would consider a success, and I do too. But at the end of the day, that's kind of irrelevant. I think really success should come from the people we're partnered with, and whether they're feeling that their engagement is making a difference for them. And if it's not, then we'll look at that partnership and how do we alter that so that it is different for them.
So does that mean you're kind of looking sort of ongoingly at why you think what you're doing is working, or altering it as you go based on?
Yeah, as you said, ICM is a new team, so there is an evaluation process, and there is they're looking at it island-wide, more of a formal kind of evaluation kind of piece. But we also engage with people in this partnership plan, and we talk about that with them regularly. So, where are we at? What's the next piece, or what is the piece that isn't working, or how do we alter it? And And again, that's not driven by us generally. It's driven by the person, them saying, you know, this has changed for me, and now I would like some help with this. So then we move along with them and alter it. So I think it's an ongoing kind of process that isn't really not sort of benchmarked, right? Where it's like, you know, a house means success. Well, for some people, maybe it doesn't. So, yeah, I don't know if I answered your question, but.
So is there anything else you'd like the viewers to know about the ICM team and the services?
Not really, I don't think. I mean, I think really this idea, well, I guess, you know, I say not really and then I answer it. So I guess the idea would be that that it is individually based with the person. So it's a partnership with the person. I think that we really strive to work from a person-centered approach, try to live in this place around harm reduction, that we try and, our focus is generally on safety and whatever that means for the person. And this idea that we're willing to change what we're doing if it's not working for the person. So I think those are probably the big pieces for the ICM team that we try and live from, is that how do we make it work for the person in a way that maybe hasn't before.
You mentioned referrals earlier in our discussion. Who are the referral agents for this program? Where would somebody get a referral?
Anybody can refer to ICM. I mean, our main mental health and substance use office is the 941C England Avenue office, and they have paper-based referrals there. Most of the community agencies within the Comox Valley have our referral form. People could, we have a phone number, all our contacts. We're on the mental health and substance use website. So there's lots of ways that anybody can refer, any agency can refer, and then we'll just work through that process with the person.
So if a community member was watching the show and they had a family member maybe who seemed that this might be appropriate, they could phone and...
Yeah, and I mean the main contact number is the 941C England Avenue office, so they could drop in there or they could call in there, and for sure they could ask about the ICM team and they would provide the information there or get in touch with us.
And that number is 250-331-8524.
Chris, what do you think a compassionate community would look like?
I think probably it would be where, regardless of how you were living, where you lived, your socioeconomic kind of status, your health status, that you were included within your community. So I think for me, that's really about what it would be. It would be non-judgmental. Everybody has a voice and has access to basic services, basic housing, basic health determinants, so that we all, so that we are able to have a value and worth in our communities.
Thank you very much.
Welcome everyone to Where We All Belong. Today we have two guests, Tom Thomas, a nurse working with the integrated case management team and doing both detox services and withdrawal services. And we have Cindy Carlyle, who is a detox nurse, withdrawal management nurse, who is an employee of St. Joe's Hospital but works in the community at this point in time. Welcome, both of you.
Thank you.
I'll ask each of you this question. Tom, who is the focus of your service and how would they access your service?
The focus of our service tends to be around some of the most complex and acutely ill people who use substances, people whose presentation often includes things like mental illness, physical illness, homelessness, and a generalized disengagement from many other services, or who aren't served well by the existing services. As for accessing those services, we're really a low barrier referral source, so people can refer themselves, people can refer family members, and of course we accept referrals from all our community partners as well.
Okay, thanks. Cindy, what about you? Who is the focus for your service, and how would they access you?
To access withdrawal management services is actually fairly easy, in that people just have to call directly to withdrawal management services, and then are set up with an appointment where they would then come in to meet with myself or a colleague regarding their substance use issues. So the service, the withdrawal management service, is for people that are 19 years of age and older and have been struggling with substance use, in that it has created problems for them in their lives.
So what happens at your services? Maybe Tom, you can answer that first. What do you do for the people you're working with?
So our team is a smaller team, but it's quite diverse. We offer a range of services that include occupational therapy, nursing services. We even have access to physicians, psychiatrists. We offer case management, counseling even to some degree. And of course this is done over a continuum, so we meet people really where they're at. If they're in that early part of recovery, we might offer something like harm reduction or withdrawal management, or access to Cindy or other withdrawal management services. And then of course we aid people in accessing other community partners as well.
Okay, and Cindy, what does happens with your service when somebody calls you and makes an appointment and works with you? What services are they getting?
So generally, Sarah, people call and set up an appointment, and again, there's really ease of access. I'm able to get back to people in a very timely manner. And so they would come in and, sit down and just, sort of have a discussion about, what sort of issues related to their substance use they're experiencing. And what I do primarily is to provide assessment-based services. So we look at, where people are at with their substance use, what it is they're wanting to do about it, and how I can help them move forward. So often we may look at a referral for a detox service including a medically supervised detox, which at this point in the community, people have to go out of the community to Nanaimo, to our withdrawal management center, and also would provide assessment and referral into our community detox services. And I would support that and facilitate that and coordinate that and work with people through that continuum until they're hooked up with longer term services.
Okay, thank you. So Tom, what are the hours of your particular that your particular services is open, and is there a cost for your service?
One of the great advancement in our services recently has been going to a 365-day-a-year service that offers extended hours from 8 a.m. till 6:30 p.m. The only cost to our service is paid by taxpayers, and so there's no actual, cost at the time of service.
Okay, thanks. And Cindy, what are the hours that your service is available, and likewise, is there a cost?
Well, no, there's no direct cost for people. And the service that is provided is available Monday to Friday from 9 to 4.
Okay, thanks.
So, Cindy, this program that you're participating in is called Where We All Belong, the series about the local substance use services in the Comox Valley. How would you say that withdrawal management fits into that continuum, or does it?
Well, that's a good question, Sarah, and absolutely I think it fits into that continuum because, for an example, if people are struggling with their substance use, they may be using substances regularly on a daily basis, and it is interfering in, lots of areas of their lives. For an example, perhaps it's interfering with employment, schooling, family, that sort of a thing. And they're wanting to sort of make a change and make a difference and move forward. In order to be eligible, so to speak, for longer term support services, addiction services, it's important that people have a period of detox or a period away from their substance use in preparation for accessing those services. So it supports people through the services and I guess along that continuum.
Okay, thank you. Now, Tom, what would you say to how does the intensive case management team and their services fit into the continuum of substance use services in the Comox Valley?
I think one of the benefits of the recent addition of our service is we're able to provide outreach services to people who probably traditionally didn't feel like they belonged. We're able to engage them where they're at, whether that be in the streets or a back alley or coming out to another office to meet with people. I think it really does epitomize VHA's endeavor to make sure people feel like they do belong.
Why do you think your service works? So what do you see in the course of your day that causes you to think, yeah, this is a good idea? That's
a bit of an emotional question for me. I spend a lot of my times in the streets and again in back alleys over at the bridge, and one of the common reactions I get when I show up to a place is, there's my team, and I feel a sense of pride when that happens in connection, and genuinely privileged to be doing the work that I'm doing. So I think it's working because the people we work with tell us it's working.
So Cindy, same question. Why do you think your service works? Like, what is it that you witness that you can say to yourself, yeah, that's glad I was here to be able to do that?
Well, I think that, the service that's provided works because a couple of reasons. One is that the access to the services can happen in a timely manner, and so people aren't having to wait for a very long time to get service. And often the people that I'm seeing are in, a state of crisis, unfortunately, where, they are not, I guess not too sure about, how they're going to move forward. And so to bring somebody in a timely manner and to, respectfully, have time to spend with them, to, help kind of manage the crisis that they're in, but to provide them with information about the services and what is out there so that, in fact, people can make an informed decision about how they would like to proceed and how they would like to see their care being provided. And, being able to make that emotional connection or that therapeutic connection with people because, again, people that I'm working with, unfortunately, based on their substance use or based on their addiction, have a relapse in that illness and need to come back. And so to have that connection and have that positive rapport, it makes it easier for people to return and look for help.
Thank you. So in the time we have left, is there anything else that you'd like to share about your services, Tom, the ICM team?
Just really that I really feel like the addition of the ICMT team has been felt and appreciated by the community and our partners, and really I want to say thank you to the community, to the health authority for providing me the privilege of being able to work with our population, because I really feel that it is a privilege.
And Cindy, is there anything else you'd like the viewers to know about the withdrawal management services?
Just that they are available, that for people that sometimes don't see, a light at the end of the tunnel, or, are really struggling, that there is support, and there are people out there that care and are willing to work collaboratively with them to, help support them and their families to, again, move forward and get back on track in their lives, or back on track with whatever it is they're doing.
I've heard many people say that it's one thing to decide to quit, but how? And so I think for both of your services, you're kind of first contact for a lot of people, and just the range of information that you have to share starts to fill in some of the hows, both with support and just information. So I've heard many people be grateful for both your services. I've heard those comments. So I thank you for being there.